Which one is this one?
This is C0 flexion and extension restriction MET. So to begin, we have to pick a side. So let's say that we've already identified a right C0, C1 extension restriction. That's going to be our first MET that we show. So from here, your contact is going to be just on the skull. So you have a nice supportive contact broadly encompassing the skull. From here, we're going to laterally flex to the side being treated. So right extension restriction, right lateral flexion, just at the very upper neck, just between the skull and C1. From here, we're going to now radially deviate our wrist, which is going to bring the patient's neck into extension, and specifically the C0, C1 junction into extension. We're gently compressing towards the patient's feet inferiorly at the same time in order to maximize this scooping motion that happens between C0 and C1. This is the egg-on spoon motion where we have this large amount of room for glide. From here, we're going to do just as we did with our other MET. We're going to press into that restriction, so pressing into extension, while the patient attempts to move down into flexion. So we can say, try and tuck your chin downward towards your chest with 20% of the force you can generate while looking up and breathing in. This is a very wordy technique. After the 10 seconds, the patient can then look down, release their breath, release the muscle contraction. After those 1 or 2 seconds, we gently find the next barrier pushing farther into extension. And the key here is to maintain this lateral flexion throughout. So we want to keep the lateral flexion because that biases the movement to the joint we'd like to treat. We want to make sure that we're isolating just the joint that needs to be treated. And this lateral flexion is how we do that. So the other restriction we can address at C0, C1 is a flexion restriction. So now let's say that we had a left C0, C1 flexion restriction. From here, we need to begin by laterally flexing to the left, again to isolate the side that's being treated. From here, we're going to place one hand over the forehead. So for a left flexion restriction, the left hand will support under the skull, the right hand onto the forehead. And from here, we're just going to push downward to facilitate this flexion. So downward meaning primarily inferiorly with just enough posterior compression to really lock in the movement. So we really need to keep the movement focused to the C0, C1 junction. From here, once we found that end range barrier, the patient is asked to tip their head backwards as if they were going to look at the ceiling, focusing on the upper neck. Again, 20% effort, eyes up, breath in. After the 10 seconds for their contraction, we can do eyes down, breath out, release the contraction, wait our 1 or 2 seconds, follow that barrier out until we find the next barrier of resistance. And then from here, we can repeat the technique again. As with the other METs, 3 repetitions is standard, and then we can reassess from there. So again, lots of words for a relatively simple set of motions, but the key here is really isolating the joint that you're working on. So starting with that lateral flexion, and then in your flexion and extension movements, keeping the focus way up high at the C0, C1 junction, not flexing and extending the rest of the neck, keeping your motion focused right at C0, C1. So questions on those 2 MET procedures? Okay, let's practice those.